All right. Good morning, everyone. Uh, Happy Tuesday. Welcome to the OH&S Fundamentals for Women Shelters number 2, Safety Management Systems 101. Thank you for joining us this morning. My name is Katie. I am the Program Development and Training Coordinator with Alberta Council of Women Shelters. I am joined this morning with Astrid Mitchell, who many of you hopefully recognize from some of our previous webinars. Astrid is an OH&S consultant with ACWS, as well as the Alberta Motor Transport Association. And she's an internal auditor for them and has a diploma in OH&S from the U of A Faculty of Extension. She has developed a passion for making OH&S accessible to the unique context of women's shelters through her work with ACWS and the Domestic Violence in Your Workplace. She has worked as a consultant for the Leading Change DV in Your Workplace with Christine Tuval for 3 years, I believe now, and is a facilitator, 4 years now, and is a facilitator with them as well. So welcome to her. We don't have time to do a round robin of everyone that's on the line. We have about 30 folks here, but I will encourage you to introduce yourself. There should be a chat box that you can introduce yourself, say hello, say where you're from, and just let everyone know who you are. Throughout the session today, we will be sending out some little poll questions for you to do. If you do have a question that you would like Astrid to ask, I encourage you to type it into the Q&A box, and we'll make sure that we cover all of them by the end of the session. And so yeah, if you do have questions that come up, type them into the chat box, type them into the Q&A, and we'll make sure we get those covered. There's also a function, if you have something burning that you need to say, there's a little function where you can put up your hand, and we will unmute your mic and let you ask your question or whatnot. We do have about an hour, and then we'll have a question and answer at the end as well for today. But without any further ado, I guess we'll begin. So I would just like to begin with a land acknowledgement. So ACWS wishes to acknowledge the land on which we live, work, and play. We recognize that all Albertans are treaty people and have a responsibility to understand our history so that we can honor the past, be aware of the present, and create a just and caring future. We honor the courage and strength of Indigenous women who have lived in this river valley, forging diplomatic relationships and as foundation builders for this province. We honor them as life givers and caregivers as we honor and learn from their continuing achievement, their consistent strength, and their remarkable endurance. The ACWS office is located on Treaty 6 territory and the Métis region of Alberta number 4. ACWS members are located on Treaties 6, 7, and 8 lands across the province, as well as the 6 Métis regions of Alberta, and members serve all nations and all peoples. Without any further ado, I will hand it over to Astrid.
Thank you for all of that, Katie. Good morning to everyone. I'm sure I know quite a few of you that are on the line, though I can't see your faces, but I'm so glad you're here with us today. First of all, I sort of want to address the title of this webinar. It's called Principles of Safety Management 101, and that's sort of a mouthful. That's a really broad concept that I don't expect you all to grasp in an hour. It's sort of a 4-level degree of education concept, but I'm going to try to communicate with you some of the basics of a health and safety management system, and certainly give you an understanding of some of the important safety concepts involved in a health and safety management system, and maybe alleviate some of your anxiety regarding all things health and safety. There could be all sorts of types of workers in this webinar. Maybe some of you have just started with the shelter that you're working at, or maybe some of you are supervisors, and I'm going to try to address all types of job positions in the workplace and sort of convey to you your obligation and your importance in the whole system. Once again, I'm not trying to turn you into an expert. And some of this information is technical, so I'm going to try to simplify it for you and also give you some examples of my experience. I've been at this close to 20 years, so I can share with you some of my experiences that apply to some of the concepts that I'm sharing with you today, and then maybe you'll be able to apply that to your own organization. So yeah, let's get started with the next slide, please, Katie. So the internal responsibility system. This is quite a large overlooming concept in all health and safety management systems. And the concept is that there are some minimum standards that an employer must meet. The employer strives to exceed those regulatory standards. Alberta Occupational Health and Safety regulations are minimum standards, but also the most important piece of an internal responsibility system is that everyone must be involved and is obligated to participate. So from the volunteers at your shelters to senior management, no one is exempt from pieces of the health and safety management system, and we all have basic responsibilities and obligations. So the internal responsibility system was the sort of precursor to some of the changes to the Alberta Occupational Health and Safety Regulation and Code back 2 years ago in June. So they wanted to more align our legislation in Alberta to fit with the demands of an internal responsibility system. So all parties in the worksite have a stake in promoting and ensuring worker health and safety, especially employers and workers. So everybody has a part to play. So that describes the internal responsibility system. Go ahead, Katie. So due diligence is another important health and safety concept that I've talked about before. And what that means is that your organization or your supervisors or your people that are directing workers have done everything reasonably expected under the circumstances in order to keep workers safe. So it's sort of a legal concept as well, but if we apply it to our everyday in the work site, are you doing everything reasonable to ensure workers, visitors, clients are safe? The 3 pieces to due diligence are foreseeability. Could a reasonable person foresee that something could go wrong? Preventability. Is there an opportunity to prevent that incident? And control. Who has the ability or the responsibility to prevent an injury or accident from occurring? And I wanted to share with you, I believe all of you know about the health and safety management system documents that are available to you on the repository from the Alberta Council of Women's Shelters. These documents were the result of an effort that Katie and I made last year, the year before, where we visited several shelters in Alberta and did sort of a pilot project in getting them health and safety management systems for their organizations. So all of the policies, procedures, ongoing, and forms that they would need to satisfy their legal requirement, to satisfy due diligence. And in that health and safety management system information, there is an excellent due diligence checklist in the forms section that you could use. It's a walk through your organization, questions, scenario, information that will help you to contribute to due diligence for your organization. So I really suggest that you take a minute and walk through your organization and use that document if you are concerned that you haven't looked at all areas of your work site. So we can move on from due diligence. There's no questions about it for sure. So legislative requirements. So today we are talking about back, Katie, please. Back one. No, to legislative requirement. Yeah, perfect. Today we are talking about the Alberta Occupational Health and Safety Act, Regulation and Code. That is this document, this bulk of information that's supplied by the Alberta government and that all employers must follow on their work sites. It also comes with something like a handy guide, which is a complement to it. So it elaborates on the legislation in the Act, regulation, and code. But everyone should be able to take this document and read it and take from it what they are required to do. There's other legislation that affects your work sites, obviously labor code, WIMIS. If your employees drive, there's the Transportation Safety Act, WCB, labor laws, and things of that nature. But today we are just talking about occupational health and safety legislation requirements and how that applies to your organization. Just a side note, legislation should be available to your workers. You should have these documents on your work site in a place where a worker or anyone in your organization can refer to this information. So they're purchased through the Alberta government website. You can purchase them, or you can download them from the website from the Queen's printer. But all the legislation that's applicable to your workers should be available to them on your work site, or at least the directions to find it online, things of that nature, if you don't want to have a bunch of expensive printing costs, for sure. So program and practice. Next slide, please, Katie. Right, so part of the legislation in Part 5 of the Alberta Occupational Health and Safety Act now requires employers with 20 or more workers at a work site to have a written health and safety program with specific elements in it. So taking that legislation and that act of law into account for today's webinar, I'm addressing the pieces of that program and practice that you all must have. Yeah, thanks. Nope. Forward. Next one, please. Next. Yes, thanks, Katie. So if we talk about an employer with 20 or more workers, that can be complicated, and there are some guidance how to calculate that, and it's available in the Act. And if anyone needs assistance with that, I can help you with that at the end of this webinar. But that would include your volunteers, right? If you have people coming regularly to your work site, pardon me. So these are some of the pieces of the legislation that employers are required to have. And most of these were, like I said, we're dealing with in this webinar. So let's go through this. A health and safety policy that states the protection and maintenance of the health and safety of workers, identification of hazards to workers, an emergency response plan, statements about the responsibilities of employers, supervisors, and workers at the work site. So those are things like responsibilities and obligations, a schedule and procedure for regular inspection of the work site, procedure to be followed to protect the health and safety when another worker or self-employed person is involved at a work site. So that's essentially subcontractors. So if you have subcontractors or contractors coming onto your site, you have to have sort of like plumbers, maybe they're fixing bathrooms, or people are coming and serving meals on a regular basis. You need to have some sort of a plan to evaluate them, to ensure that they're aligned with the health and safety goals of your organization and that they understand the rules when they're on your work site. We can move to the next advance, please, Katie. Yeah, worker and supervisor health and safety orientation and training. We address this later on in this webinar as well. There has to be some way of onboarding workers specific to health and safety. Procedures for investigating incidents, injuries, and refusals to work. Procedures for worker participation in worksite health and safety, including inspections and investigation of incidents. So you see, whenever you see that word, those words, worker participation, that's referring back and aligning with the internal responsibilities system so that everyone is participating and involved, and it involves all areas of your worksite. Procedures for reviewing and revising the health and safety program. So one day we print this massive health and safety management system document and we leave it on a shelf to gather dust. That's The best thing I see when I go to a work site are coffee stains and tattered pages and pieces and highlights and post-its in a health and safety management system, because it means you're addressing it and you're reading it and you're looking at it and you're applying it. Just printing it and sort of having someone look at it in an orientation does not in any way fulfill your duty for due diligence at all. So that's another piece. As well, any key elements set out in the regulation. So that little sentence, any key elements set out in the regulation, refers to the bulk of this document, which is all of the specific legislation about first aid and WHMIS and hazard identification and things that could apply to your work site. But we've provided a lot of that information to you in the safe work procedures. So you would be able to go through those safe work procedures, decide what applies to your organization, pick through them, and there you go. You've got key elements set out in the regulation. One piece I wanted to sort of address in this program and practice portion of the webinar is something called a certificate of recognition. I don't believe any of the shelters have met this standard, but in industry, it's generally a requirement for most employers in Alberta. So a certificate of recognition is a set of standards or elements that the Alberta government has set out in something called the Partners in Injury Reduction Program, and employers are measured against these elements in an audit. So if you pass this audit, which contains these 11 elements, you would receive something called a certificate of recognition, or a CORE. And a CORE certificate means you've met this certain level, these certain minimum standards, and you're on your way to having a safe workplace. And so it gives you discounts to WCB, and sort of is a very proud statement that you have met these set of standards. Some of you might know about the CORE audit or the CORE requirements outside, maybe your spouse or your partner's involved with that. So that's the kind of auditor that I am, but that's another piece that would contribute to due diligence. And I strongly encourage in the evolution of your health and safety culture in your organization, having a look at that CORE audit process. We can talk about that in another webinar if possible, if people are interested, but it does certainly encourage you and help you to go through the elements of your health and safety program and meet all the standards of the internal responsibility system. That's kind of what the CORE audit is about. So I did want to mention that in this webinar today. So my point is to go through this program and practice these pieces that you need to have and simplify it, and we'll go through all of this today. So we can move on to the next. So the health and safety management system elements. So these are the pieces of the documents that we have provided to you on the repository. These are all of the working pieces that interact in your organization to fulfill your responsibilities of the internal responsibility system. And these are all of the pieces of the basic part of the health and safety management system on the repository. The information provided comes with excellent complementary forms of any type you can imagine, and you can apply those forms to your organization for what you need. You in no way need to use all the forms or print off all the forms. We're just giving you a ton of information that you can choose, and they're all in words, so you can edit them or change them or add them as you need to. On this slide, the things that are highlighted are what we're going to focus on today. Communication and leadership, hazard identification, risk assessment controls, legislation requirements we've already talked about, inspections, qualifications, orientation and training, emergency response planning, incident reporting and investigation, and health and safety committee and safety representatives. Now, this PowerPoint is available to you in PDF with this webinar. So, you know, you might be frantically taking notes, and that's great, but all of this information will be available back to you in the PowerPoint presentation. And we have some complementary resources that you can refer to as well. Those resources I refer to regularly, and they're right off the Alberta OH&S Occupational Health and Safety website. And there's a lot there that you can refer to if you need more guidance on some of these concepts. So let's move on. We can talk about communication and leadership. So this is the starting point for all organizations that are kicking off a new health and safety management system. This is where we want to start by demonstrating and communicating your commitment to health and safety in your organization. There are several ways we can do this. Some of them are a yearly commitment statement, maybe a yearly letter, the New Year letter that talks about some of our safety goals for the year. Conducting regular safety meetings. I try to keep sort of operational meetings and safety meetings separate. Sometimes that's difficult, but if you want to combine them together, maybe some of the things that you're discussing align, but a regular safety meeting schedule, if it's possible in your organization, is great. Or even if it's your morning coffee with your workers that day and sliding in something like, oh, let's make sure that we get that cleaned up, or so-and-so, it's your day to do the kitchen inspection, things of that nature. You want to really regularly communicate health and safety in your organization. One of the most leadership concepts is walk the talk. You need to follow the rules that you're expecting of all of the workers on your work site. We don't want to bend those rules. You really want to be a rule follower and a leader in your organization and set an example of how other workers are expected to behave and follow those rules. Budget for safety needs. I understand that money is tight, but we really want to make sure that the things that are needed and are important for our workers, we're able to provide. Some employers even implement health and safety incentives. We really want to offer training and orientation and information to our workers about health and safety. That really demonstrates leadership, as well as follow through. Someone does an inspection and says, you know, this door has an issue with slamming and it could hurt someone. You really want to make sure that that gets fixed somehow. You really want to follow through with any identified hazards. We can go to the next slide, please, Katie. So basically, the framework for a health and safety management system starts with a health and safety policy. The health and safety policy provided to you in the health and safety management system includes this. These are the first sentences in the policy. So you would insert your shelter name, is committed to providing a healthy and safe work environment that addresses the protection and maintenance of health and safety, including physical, shouldn't say that twice, we can remove that, but psychological and social well-being of employees in order to prevent occupational illness and injury. The shelter is committed to work in a spirit of consultation and cooperation with employees, and our documented health and safety management system shall form the basis of all operations undertaken by the shelter. The policy has a place for sign and date to be signed by the most senior member of the organization. And my suggestion is to really have a place committed to health and safety communication in your organization. A bulletin board in the lunchroom, a bulletin board in a shared space, somewhere where you can post health and safety information and only health and safety information. It would be my guidance not to post like vacation schedules and takeout menus and stuff. This is all about health and safety on this board, and you'll be able to find the information you need. An important piece of that is the signed health and safety policy. And this could be reviewed regularly with your workers, like once a year. Let's go over this again and let's recommit ourselves to this. and absolutely should be a piece of your onboarding, that they would have to read that and look at it. It also communicates to workers, visitors, and clients and contractors and the general public that your organization is committed to health and safety. So you could post that in a visible place, maybe in the foyer and the entrance of your building for sure. And this is just one example of a health and safety policy. You may want to tweak it and change it to suit your needs, but I would certainly keep the information regarding equipment or a commitment, pardon me. We can move to the next slide, please, Katie. So here's another really important concept of the internal responsibility system of any health and safety management program. Workers' 3 basic rights. I'm hoping that most of you understand what these are, but we're really going to take a minute to talk about them right now. So first of all, every worker in Alberta has these three basic rights, and this aligns with federal legislation as well. So essentially, these are the rights that are all across Canada, and this is also one of the changes to our legislation 2 years ago, was to align with these 3 basic rights, and they are the right to know. So workers need to know and understand workplace hazards in order to keep themselves safe. I think we talked about this briefly in the last webinar. I hope some of you were able to take that webinar on formal hazard assessments. If you weren't able to take that webinar, if you could listen to the recording of it or review it, would be great, because formal hazard assessments are a fundamental to any health and safety management system, and we'll talk about them again further on in this presentation. But the formal hazard assessments that we talked about, which are assessing hazards by job description, really starts to fulfill this right to know. When you're onboarding a worker and you hand them the formal hazard assessment that says, these are the tasks you're going to need to perform, this is what could go wrong, and these are the measures we have in place to keep you safe, that really fulfills that right to know hazards. So the second basic right is a right to participate. So when we talk about the internal responsibility system and how that involves everyone in the work site has the obligation and the right to participate, to be involved, which essentially means report hazards. So everyone has the right to be involved. That's why now in Alberta we need to maintain a joint worksite health and safety committee or health and safety representatives, which we talk about further in the webinar. But certainly all workers need to understand that they have the right to speak up in a safety meeting, identify hazards, be involved in investigations if they ask, participate in formal hazard assessments, and be involved with all pieces of the organization's health and safety management system. And then the third of the workers' 3 basics rights is the right to refuse dangerous work. And I really wanted to address that, especially in the era that we are now, the era of occupational illness, which is COVID. Those workers at the Cargill plant, if that COVID diagnosis can be traced to that Cargill plant, then that is a WCB reportable illness and an occupational illness at that work site. So I really wanted to talk about, in the next slide, we sort of go through work refusals and what that means, your right to refuse dangerous work. So we can move on if you'd like, Katie, please. So work refusals. So employees must be provided training on work refusal procedures. So that would be part of your onboarding process. No employees can be reprimanded for refusing work if they feel unsafe. That's discriminatory actions. You can't transfer them or demote them just for reporting unsafe work. Work refusals must immediately be reported to a supervisor. All related work must stop and may not resume until the concern has been addressed. All work refusal occurrences will be inspected and documented, and I go as far as to investigate them. and corrective measures will be implemented where unsafe work exists. So that's an important concept. We have to decide that unsafe work exists. So in terms of work refusals, I wanted to share with you a couple of my personal experiences with work refusals, and both of these were in the last year. Most recently, I had a worker early on in the COVID crisis call me and say, I feel unsafe to go to this work site. She was directed to drive to a work site and change out some equipment and come back. But it was common knowledge that someone was waiting for the results of a COVID test. And so she didn't feel safe going to that work site. So we had a conversation and I brought all the involved parties together, and we came to the conclusion that it was not important for her to go to that work site until the results of that COVID test were shared with everyone that was expected to go to that work site. As well, we implemented some more controls. We reviewed that task on her formal hazard assessment and decided, hey, let's implement some more controls. Now, this was very early on in the COVID crisis, and the Alberta government hadn't given a lot of information to employers yet, but we put some early interventions in place. The conversation was had as a group, including the supervisors and anyone else that would be required to do that work. We waited till the COVID test came in, and it came in negative. After all of the other controls were put in place, all of the fear based on that work site was removed and work carried on as normal. I did document the work refusal, did a bit of an investigation, including actions that we'd used to prevent this happening again, but it was resolved with the worker and the supervisor working together to find a resolution. When an employee formally refuses work, you need to address it. You need to look at it. A second instance that occurred, there had been some instances of some disagreements between workers on a work site. And one of the workers that was in this disagreement left for the day. He didn't work in that work site all day. And the person left behind said, I'm refusing to work. I feel unsafe. And the manager said, look, I will reprimand that person. We're going to deal with that person about your disagreement, but he's not here for the day. So I'm going to be here all day. So I'd like you to continue working. And he refused to continue working. And then that's his right to call occupational health and safety. So an occupational health and safety officer came out and inspected the work site based on his work refusal. It took a few days and that person stayed home, didn't work. And the officer deemed that there was no unsafe work existing at that work site. And the worker was directed to return to work. So it was resolved, including occupational health and safety. And that's absolutely fine too. And you need to know that you're welcome to call them even with any questions that you have. If you go to the Alberta government website and it talks about under occupational health and safety, you can ask a question and you can call an officer at any time and it will assist you with that, with your questions. You're also welcome to call me if you'd like. I will do my best to answer your questions for sure. But in the event of a work refusal, that cannot be resolved between the parties involved. Probably a good idea to involve occupational health and safety. So those are my two work refusal stories of recent nature. In my experience, obviously work refusals are fear-based, so work together to alleviate fear and address the concern. Do not resume work until the concern is addressed. The next slide, please, Katie. So I wanted to talk about employer rights because yes, we all have 3 basic rights as workers in Alberta, but as well, an employer certainly has rights involved on a work site as well. Oh, cool. That's really great. So I'm assuming we have to take a minute here for this poll. And if there's any questions regarding this, I will certainly do my best to address them. So I can move on and discuss employer rights. So, this could be posted as well because, in terms of the internal responsibility systems, there's two parts to this, right? There's expectations of employees to follow the rules and policies and plans and procedures that they've been trained to follow. We have expectations that employees will follow the required legislation. You're required to wear your seatbelt. I expect you to do that when you're driving on behalf of this company. We expect all employees and management to participate in the safety program. We need your feedback. I can't do my job in a vacuum. We need to all work together. Expect all employees to participate in the hazard identification and reporting process. That's the way a safety culture and a safety system evolves, is you deal with the hazards you know about, but you don't know what you don't know. So as soon as you find out through the reporting process, then you can deal with that hazard as well. Include it in the formal hazard assessment, investigate the hazard, and apply controls to it. And I think it's important for employees to understand your expectation. The next slide, please, Katie. So hazard assessment. So a hazard assessment is the most important piece of your internal responsibility system. An employer must assess a worksite and identify existing and potential hazards. An employer must prepare a report of the results of a hazard assessment. This is what formal hazard assessments point to. They start the process of identifying hazards on your worksite and inform other pieces of your worksite by identifying those hazards. We must evaluate for risk, we must control the risk, and then we must readdress those hazards to make sure that nothing has changed, right? Let's look at them again. We can't just do this once and leave it. We have to readdress it and revisit it. So this piece of legislation, these two sentences really point to that formal hazard assessment webinar. And in the future, if people are interested, we can do several on hazard assessment, but here's the legislation that applies to it. We can move on, Katie. Oh, so does your organization have formal assessments for each job description? It is an ongoing process, especially if you are changing job descriptions or if you are combining job descriptions, but someone needs to be able to look at the formal hazard assessment because I am the person that is cooking now at the shelter. We've had, maybe some of you, in order to address some of the COVID concerns, have hired a cook. So do you have a formal hazard assessment for your cook? Have you gone through those tasks? And have you identified the hazards, evaluated the risk, and implemented controls for that? If your formal hazard assessments are in development, that's great. Work as teams to finish that off. Work together, delegate that formal hazard assessment. But I would certainly get it done and get it communicated as soon as you could. Other pieces, other important parts about hazard identification is using investigations and maybe the root cause of investigations or things that have come out of an investigation of an incident to inform your hazard assessments. Oh, wait a second. Ladder safety has become an issue. Someone didn't understand how to use a ladder properly. Have we addressed climbing ladders to change light bulbs for the maintenance person on your work site? Oh, wait a second, ladders aren't even a part of this. Okay, let's go back and readdress and relook at it.
Astrid,
Yes.
Can I interrupt you for 1 second? There's a really good question from Noreen Cotton
Oh, hi.
about work refusal.
Perfect.
Her question around work refusal, so it says work refusal during a pandemic at a women's shelter, which is an essential service, can be tricky. It says we
Right.
cannot stop all related work until refusal to work is addressed. If it is confirmed case of COVID-19 in the shelter, either a staff member or client, we can't
Right.
shut down the shelter. Would love to get your advice on this particular situation.
So any confirmed cases of COVID-19, first of all, involve Alberta Health Services, right? And public health. So if there was a confirmed case of COVID-19, the first call I would make would be occupational health and safety. And they're going to help you in the application of occupational health illness procedures in your organization. If you do have a work refusal in terms of COVID, it is possible to have another worker do that work. Maybe the other worker has more training, or maybe the other worker has more experience, as long as that worker is informed of the work refusal. So there are pieces of work refusals that Alberta Occupational Health and Safety can assist you with. COVID is new for all of us on all work sites. And I think in the last 2 months, a lot of information has been shared and developed through the Alberta government website for COVID. There's a lot of assistance for employers there as well. So my guidance would be to have a plan for the work refusal. So Katie and myself and I'm sorry, Katie, what was the person's name who assisted us with the formal hazard assessment for COVID?
Prisha.
Lisa. We sat down last week for a couple of days and did an actual formal hazard assessment for COVID-19. And it included procedures and policies for work refusals and what to do in case that happens. So that formal hazard assessment will be shared with everyone soon, I believe. But we actually went through all of the scenarios of a shelter and the application of exposure to COVID. So I hope that helps you. I don't have the specific answers without the specific context of the work refusal, but those are some of the ideas for the assistance. And I think I sent a document in the resources for work refusals as well. So that could help you along the way with that too.
Thanks,
Does that
Astrid.
Does that help?
Yeah, Noreen, if there's more context that you want to provide, feel free to type it in. But so from my understanding, just to clarify that it's not necessarily that all of the work has to stop if there's a work refusal, but it's just that one employee that refuses that work stops that particular work. It's
Yeah.
not, okay, perfect.
Everyone. So in the instance of the person that was to go do that delivery and pickup, it was that one site that we decided to stop going to, that one part. Everybody else was still working. The whole organization was still trucking along. It was that one piece that we stopped, if that makes sense. So if you have a work refusal at one piece of your organization, that doesn't mean workers stop working from home and your admins stop working and maintenance stops. It's to that one employee's job description and task. Yeah, thank you for that, Katie. Okay, so we can move on from hazard identification, risk assessment, and controls. So, sorry, let's stay here for 1 second. Sorry, let me get my train of thought. There is a lot of information in the health and safety management system that will assist you through this, including all of the documents and the forms. But what this means is that employees need training. They need to understand how to identify hazards and what that means. And so we have some suggestions for some online training if people are interested in that. But certainly this part, this hazard identification, understanding what the issues are, is the big part of the whole program, and it sort of all revolves around that. So we can move on to the next slide, please. Or was there any polls about hazard identification? Maybe not. I don't think so. Okay, everyone. So on to inspections. So inspections are a perfect part of your system to involve workers, right? You don't want the same person who I don't know, cleans the kitchen to inspect the kitchen. You don't want the same person that's in charge of maintenance inspecting the office. You want to share this off with workers and involve them in the inspections. So the purpose of the inspections is a way to review and verify compliance with the organization's health and safety management system and proactively identify potential hazards. So anything documented on that inspection needs to be fixed and addressed. But there are two types of inspections. So informal inspections, that is something that I just do as a nature. When I walk into a room, I have a look and I look at it with a critical eye and see. We all do that. As you know, we need to wipe that spill up. We need to move that tripping hazard. We need to address the fire extinguisher. So you want to do those formal inspections regularly, and they don't need to be documented. Informal inspections. We can move on to the next slide, please, Katie. So informal inspections are carried out by employees, supervisors, and managers and do not involve a formal report or a specific schedule. Have a look at your equipment before you're going to use it. Have a look at your workstation and make sure you've got no tripping cords or overexposed cords or an overused electrical outlet, things of that nature. Formal inspections are carried about by everyone in the workplace, and they involve a report or a document. If I refer back to the forms in the health and safety management system, there are several examples and types of inspections that you could be doing for your work site. Just make them specific to your site because they are Word documents. So here are some examples, something about a vehicle or journey management. If you're a shelter that's in northern Alberta and your workers are traveling from Grand Prairie to Edmonton, they might want to do some sort of a vehicle inspection and a journey management inspection before they take off on their long drive, especially in the winter. Pre-use of equipment, files and paperwork. Does the orientation file for this employee have everything that they need and all of their orientation and training? And is their training current? Fire inspection, building inspection. You can use your local fire department to assist you with that as well. Pre-job hazard assessments, that's another form of inspection, and work site inspections. Random site inspections of people, processes, and equipment, identifying hazards. And like I said, there's an excellent selection of forms in the form section of our health and safety management system. We can move on, please. Inspection schedule. So this is really important. An inspection schedule that documents when inspections need to be completed and who's going to do them eliminates a ton of weeds from the whole inspection concept. Let's decide in January how often we're going to inspect this piece of the work site. And by December, we'll have inspected the entire work site, and some of those suggestions in that formal slide beforehand can sort of help you with that. We're going to document those inspections. We're going to review them in safety meetings. Okay, so here's the safety meeting for June. And in May, Astrid went through the work site and she found this, this, and this. And when she found them, we fixed them by doing this, this, and this. You want to make sure that any deficiencies reported in an inspection are fixed, obviously. That's an important part of it. And also you want to include your joint worksite and health and safety committee or your health and safety representative. Those people need to be involved in the inspection process, so we want to include them in that as well. And once again, if you think about the internal responsibility system, we're going to involve everyone in the worksite in completing inspections. Next slide. So incident reporting and investigation. It is my guidance to all of you that if you have someone on your work site that is responsible for investigating incidents, get them some training. A lot of supervisor and leadership training includes a portion on incident investigation. I've been learning and relearning and rediscovering incident investigation for 20 years. So we really want to include some formal training for those people that are responsible for doing incident investigations. The health and safety management system provides an excellent section on procedures and what to report, what to investigate, but certainly at minimum, you want to take the time to have a look at and investigate near misses and hazard identification, anything that's been reported. Absolutely investigate any injuries or incidents, but certainly incidents of workplace violence and harassment. Occupational illness, which is COVID. Work refusals should be investigated. And like I said, violence and harassment. So those are some of the ideas. We can turn pages, Katie, if you'd like. Thank you. So our policy, it requires the immediate reporting of all incidents, including near miss injuries, illnesses, property damages, work refusals. Employees need to report incidents and they have a duty. Not 3 days later when they've thought of it, oh shoot, I should have told you about how I cut my hand. You know, you want to be informed immediately. This information should certainly be part of your onboarding process. The obligation and the responsibility to report, that's part of that internal responsibility system as well. All incidents are investigated as soon as possible after they occur. Certainly, in the case of an injury or there's immediate danger that needs to be addressed, but someone needs to be responsible for investigating that. All employees should be trained in these standards and the duty to report. And we can do refreshers in team meetings and safety meetings to enforce the importance of incident reporting. Failure to report incidents, hazard work conditions, or near misses shall result in disciplinary action. So really, it's an important piece. We need to know what's going on your work site. So if you turn the page, please, Katie. Here we go. So this is a really great flow chart for when an accident occurs. It's kind of hard to see, but it's part of your health and safety management investigation section. And it talks about how incidents should be responded to and addressed. So we have, it's reported to, if something occurs. Let's take an example. Somebody falls and is hurt. And Katie has first aid training and she's come to help that person. So do we need an ambulance? Do we need to take them to the doctor? Do they need to visit an emergency room? What's going to happen with their injury? So we must assess the situation, protect the injured people, give them first aid, call for help, secure the scene, and evacuate if possible. If we need to evacuate the building, if there's a fire, if something is going on, we need to evacuate the building. So then the next step is the evaluate the severity potential. So who is going to investigate it? Did she fall and she's okay? And we're going to figure out why she fell? Or is she on the way to the hospital and what is going on? And who needs to know? So then we need to collect evidence. Once the injured has been attended to, is being taken care of, we need to protect the scene, see if there's any witnesses, examine equipment, examine records. Do we need to do some drug testing? What are the drug testing requirements on your work site? What's your drug and alcohol policy? So we can analyze causes when we do the investigation and review that analysis. Really important to include actions to prevent reoccurrence, right? Did the person on the ladder, were they openly defiant? Do they need to be disciplined? Did they do, was it something about not following rules properly? Did supervisors or management ever not enforce the rules? We can really always, most investigations and most incidents can go back to a management level for sure. And we always must take another look at our formal hazard assessments after an incident. Do we, like I said, do we even have ladder safety in our formal hazard assessments? So when we're implementing actions to prevent reoccurrence, we want to think about, okay, how can we make sure that Astra doesn't fall off that ladder again? Do we need to Does she only need the training, or does everyone in the organization need ladder safety training? Can I address this in a safety meeting and a bulletin, or do I need to bring in an expert? All of those items can be discussed in the actions to prevent reoccurrence. And an important note is incident investigations are another part that does not happen in a vacuum. When I'm on a work site and I'm investigating an incident, I am getting people that do that job and are involved in that to share with me their experiences and their thoughts on what happened, because I want to get all opinions and make sure I make an informed decision about the actions to prevent reoccurrence. We don't want them to cause more incidents. We want to make sure that we're preventing and not causing more problems. So you really want to involve other like workers that are doing that sort of job, as well as your joint worksite health and safety committee should be involved with your incident investigations. So this is a great flow chart. You could print it off, have it on a bulletin board in someone's office that does emergency response or is involved in this, but it really walks you through what you need to do, as well as those supporting documents that are available in the forms. I think there's a poll question about incidents, I believe. So have you ever been part of investigation on your workplace? And that can be as the person performing the investigation or as the worker who was involved in the incident. So have you ever been part of a workplace investigation? And were the results of that investigation, just think about this, communicated to you? Something ever happened when you were working and no one really was like, what happened there and what did they ever do about it? Part of communication and leadership is communicating the results of an investigation and having people understand we care about you and we're going to make sure this doesn't happen again, and this is how we're going to do it. We can move on, Katie, to the next. So I want to address a little bit about the duty to report. There are certain incidents in Alberta that it is a legal requirement to report it to occupational health and safety immediately, as soon as possible. So those are the incidents in this list here. So results in a death, heaven forbid, results in a worker being admitted to hospital, involves an unplanned or uncontrolled explosion or fire or flood, involves the collapse or upset of a crane, derrick, or hoist. I know that doesn't apply to you, but I just want to make sure you have the exact legislation, and involves the collapse or failure of any component of a building or structure. So that could even include a shed. So if we move back to results in a worker being admitted to a hospital, that specific piece is important to understand, because that doesn't include the emergency ward. So you could go to the emergency because you think you've broken an arm, but unless you need surgery on that arm, you haven't been formally admitted by a physician. So that's the sort of clarifier in that. Having said that, if someone is injured and it is obvious that they are going to be spending some time in a hospital, you need to phone Alberta Occupational Health and Safety sort of as soon as possible. You need to involve them. They want to know what's happened on your work site. And you should be prepared to provide a general description of what happened, the location of where the injury occurred, some contact information like your contact information, time and date, and name of employer. I would certainly delegate the duty to report to senior management of your team on your health and safety at your shelter. That would be something that a manager would decide, or someone with some supervisory obligations, and we want to make sure that they understand when and where to report. It's the number to report for Alberta OH&S is available on their worksite. I have it here. It's 1-866-415-8690 is the phone number. So even if you're unsure, you can call them and say, look, this has happened. I just want to make sure that you understand. The next steps after you've reported, your duty to report, is Alberta Occupational Health and Safety will investigate. So they will come to your work site. You will have to secure the scene. They might put some stop work orders in place. they may not. You may have some orders and demands and things you have to fix based on the injury, but Alberta Occupational Health and Safety will definitely want to be involved in your investigation of the injury. Does somebody have a question, Katie?
No, no questions.
Okay.
Sorry.
Are we all, what are we at for time? 1 hour. Okay, we're getting through here. So the next slide, let's move on to qualifications and training. I know that all of your shelters have pieces in place to ensure that the workers you're hiring are qualified for the job you're expected them to do, and that you give them ongoing training to ensure that they keep up to breast with changes or information that they need to know about their job. But I want to really like focus in on orientations. So, and competence. So health and safety competence is a combination of knowledge, understanding, and skill. And the appropriate level of competence cannot be acquired simply by attending a training session. We really want to evaluate that skill. The understanding and skill are required by experience. For individuals controlling health and safety hazards and risks, experience and training are essential. So we really can give that person the tools that they need, especially if that's their job, to conduct that hazard assessment and risk. So we want to really ensure that we give those pieces and set your workers up for success in terms of this. So there are a lot of health and safety certifying partners and training available to you. And if you need any assistance with that, please let us know and we can give you the information that we need for that. But if we move on to orientations and training, the next slide, we really want to talk about like onboarding workers on the first day before they start work. They need a health and safety orientation. You should conduct that orientation on their first day, and it should include things like a site tour, personal protective equipment, which is so important now. We've been talking about a possible health and safety exam after they review the orientation document, and some training that they might need. Maybe they need to take first aid training, or maybe they need PPE training, how to use, maintain, and dispose of personal protective equipment. Some of the other pieces to an onboarding procedure should include safety policy, a list of safety rules, which is a section of the health and safety management system. You could go through those basic rules and tweak them for your organization if you needed to. On the workers' 3 basic rights, including the right to refuse, workplace violence and harassment policies and procedures. There certainly should review in detail the formal hazard assessment for their job position. You've done all this work to create these formal hazard assessments. Let's make sure that you communicate that information as soon as a worker is being onboarded or before they start work on your work site. Hey, these are the things that we want to do. This is your job description. These are your tasks. This is how things can go wrong. And these are the things you need to know in order to keep yourself safe. And emergency response. Where are the fire extinguishers? Where is the muster area? Where do I need to go? Who do I need to call? What are the procedures for any emergencies? So I think an orientation and an onboarding specific to health and safety is really important, especially on your first day. And we can move on. Emergency response planning. Each worksite must have a plan that identifies all potential emergencies and instructions to deal with these potential emergencies. So you must evaluate your worksite for emergencies and plan your response. Your formal hazard assessments inform your ERP. What could go wrong? We could have vehicle collisions. We could have bad weather. We could have like a fire. They're working in the kitchen. All of those things inform what you should have a plan for, what emergencies you should plan for. As well as incident investigations should inform your emergency response. Oh no, we didn't have a plan for when Astrid was unconscious or something, right? We need to ensure that any incidents that occur, that we have a plan for that emergency. And we should include opportunities to test the emergency response plan through drills, evacuation drill, mustering at the muster point, and how long does it take? Who is going to sweep the building? All of the pieces of evacuating your shelter, and include all workers. What I do is in my safety meetings every month, we address a part of the plan. So once or twice a year, we do an actual evacuation and drill and time it and evaluate it. And then other parts of the year, we just do like what's called a tabletop, where we just in the meeting all together sort of discuss what our plan would be for a flood. I mean, that doesn't apply to all parts of you, but it could happen if there's an issue with a water pipe breaking or something of that nature. So you could go through that just in conversation and just sort of discuss the scenario of that emergency. But please ensure you document any sort of evaluation of your emergency response plan. And a safety meeting is perfect for that because it just can be in your safety meeting minutes. So that's an excellent opportunity for that. And it's always like a reoccurring agenda item on safety meetings, so to go through planning. So we can move on to the next slide, and it's emergency response planning. So here's some ideas, some of the emergencies that are addressed in the health and safety management system. So vehicle collisions and breakdowns, medical emergencies, and it's all types of medical emergencies. So it's really it's been evaluated well. Fire, explosion, extreme weather, forest fire, and maybe there's some other emergencies that has occurred on your work site involving clients. You know, we want to plan for the response to that. And I think there's a question regarding this, right, Katie? I'm pretty sure we had a question involving emergency response planning possible. But anyway, we still want to include some potential examples of what emergencies could be in your health and safety management system, for sure.
Sorry, Astrid, I forgot to include that one.
That's okay. Okay, we can move on to the next. I was curious what some of the emergencies on your sites might have been, but you can include that in the health and safety portion for emergency response planning. So let's talk a little bit about health and safety committees and representatives. Hopefully your organization, if required to do so, has one or the other. So a joint worksite health and safety committee is required for work sites where there's 20 or more workers. And work sites with 5 to 19 workers require a health and safety representative. And you must develop a terms of reference for your joint worksite health and safety committee, and it must meet about 4 times a year. And that's part of the internal responsibility system and fulfills the worker's right to participate. They can come forward and say, hey, I want to be on this committee. I would like to be part of this. Generally, for me, I ensure that the committee includes all parts of the workplace. So you have workers that are doing different jobs that can inform the committee based on what they do. And that brings all of their knowledge and information about their area of your worksite. And we really want to make sure that all the employees know who those members are, because that's part of their right to participate as well, because they could inform a committee member if they've got some hazards they want to report as well. So we can move to the next slide. Health and safety committees and reps assist employers to respond to health and safety concerns of workers. So, you know, Astrid's a big meanie. She intimidates me. I'm going to go to Katie because Katie's on the Joint Worksite Health and Safety Committee, and I'm going to just talk to her. And that's not true, but you never know. Develop health and safety policies and safe work procedures, develop and promote education and training programs, participate in worksite inspections and investigations, investigate worker reports of dangerous work and refusal to work, and they could have assist employers with health and safety orientations. Now ensure that you see the word assist. So this joint worksite and health and safety committee doesn't do all of these things without communication and cooperation of the employer. You're working together, right? They can make suggestions, but not always it's the employer that ultimately would make that decision. So we're getting towards the end here. The last slide is discipline and enforcement. So certainly part of your onboarding process, it needs to be really clear that we have a discipline and enforcement policy and procedure, and involves management is committed to the safety of its employees by providing an injury and incident-free workplace. Disciplinary action may be taken when any violation of the organization's health and safety rules, policies, and/or procedures occur. And we have a step-by-step sort of process for disciplinary action, which involves like a verbal warning, a written warning, suspension, and termination. You know, it doesn't always have to happen in that order. In your safety rules, there could be some, violations that would mean automatic termination. So you would be able to determine what those might be. And we can also need to sort of think about not only defiance of rules, but incompetence. Maybe they weren't trained properly. Maybe they didn't have the information that they needed. So your health and safety system procedures for discipline involve both of those scenarios. And like I said, I would certainly inform employees on their first day of work. We need to be able to enforce all of the rules and the policies and the elements that we've put in place, and they need to understand that we have a process for that. And we're here at our last slide. So I have a few, does your organization have a discipline and enforcement process? And if so, do you understand, and are you understanding how it works? Have you been given information about that? That's certainly something that could be posted in that health and safety information area, bulletin board place that's dedicated to health and safety communication. You could certainly post information about the discipline and enforcement policy, just so that it's really clear with workers what the steps might be.
Okay, thanks, Astrid. I'll give folks a minute to answer that poll, and I'll just encourage folks, if they have any other questions, to type them into the chat box. I do have one more question around worksite health and safety committees. So the question is, we have 25 employees and 2 volunteers. However, we never have that many on site at any one time. The most we have at one time would be at a staff meeting, for example, is 16. So the question is, do they need a committee or just a representative?
So there is guidance in the Alberta Act in regard to calculating workers, because that was one of the changes that our new government made to the Act. So initially, when you may have started your joint worksite health and safety committee, there was this 90 days or more, and there was a flow chart that calculated how many employees that you had and that your need for a committee or a rep. Now it's just based on the number of workers. It doesn't matter how long they're at a work site. So my guidance to you would be, if you've got over 20, you need a committee, but you can also make one of those calls to Alberta Occupational Health and Safety to get that clarified. But there certainly is guidance on calculating workers, and I can send that information to you because it's new. It's not in the information that I have. In fact, I think it's in the resources that I gave to you, but that's one of the results of the change to the legislation. It's not always crystal clear as to how many are on a work site. And so in removing that flow chart, the new government thought that they were sort of simplifying the process, but it's been my experience that it's complicated a little bit. So a general rule would be employed of 20 more people, then you've got to have a joint worksite health and safety committee. But to clarify it, you could call Alberta OH&S. sorry, I can't answer that question in a really effective way because it's not black and white in calculating the numbers of workers that you have. Does that help? I hope it does. If you'd like, I can send more information to that specific. I can look it up and get the guidance for calculating it. I just don't have it right in front of me right now, and I can email it to you if you'd like.
Perfect. Well. I can send that in the follow-up email to everyone, so everyone can get that. So it is based on each site, because I know many of our members have multiple sites, like they'll have multiple shelters. So it would be for each site, depending on the number of workers, they would need a committee or a representative.
Yeah, we'll get you that information. It's in the new guidance from Alberta on the Occupational Health and Safety site for the Alberta government. So I'll get that to you. Because it's a big difference having an HSR and having a joint worksite health and safety committee. That's a lot of people. That's a lot of wages because you're paying them for those meetings. So I really understand the need to really clarify that for sure. So I'll get that to you.
Thank you, Astrid. There doesn't seem to be, sorry, go ahead.
One more slide left.
Oh, sorry.
Yeah, sorry, my bad. I said this was so tips. So in my 20 years, lots of tips, but these are sort of the big ones. Document. It doesn't need to be, if you've got a formal form to document, great. If not, have a notebook and take notes. Document what you've done, the efforts that you've made. Don't lose all of the headway you've made by not writing things down and having things documented for sure. You really want to make sure that that's part of it. Safety meeting discussions, any changes to formal hazard assessment, incident investigations, near misses, document it. Really have that information on hand so you can refer back and remember. Schedule reoccurring events, inspections, safety meetings, etc. Sit down at the beginning of the year, create a schedule, use the calendar on your Outlook, whatever you need to use to trigger you to ensure that these things happen. But if you're in on this webinar and because you're expecting your employer or whomever has expected you to just take care of all of this, that is not the way to do it. We need to delegate and include your entire workforce. We want to have a functioning internal responsibility system that includes everyone on your workforce. So pick people, delegate. I like to choose people that are safety minded. I want people to contribute. So if I'm asking someone to help with something or asking their opinion, I choose people that are safety minded, right? Refer to the definitions in the Act and Code. If you need clarification, all parts of the Act and Code have definitions at the beginning. And so if you need to clarify something, first refer to those definitions in those books. That will help you to, if it's a gray area, certainly it does help me most of the time. And safety is a culture of sharing. So work together with other shelters. If, you know, one shelter, their formal hazard assessments are completed, you need to do your own for your own workers, but it could help you, you know, or maybe one shelter has a great emergency response evaluation, or let's share this information because we all want to keep each other safe, right? We all have that responsibility to be safe. So share information, share knowledge. Email me if you need to. I'll help you as best that I can. Email Katie, communicate with us with what you need. I think their plan is to do more of these webinars going forward. I certainly love to talk about this and share things all health and safety. So if there's more things that you're interested in or need more information on, let us know. We want to help you improve your work site. So I think that's about it for today from me. So I wanted to take some questions. Thank you all. I know this is so much information, and the last thing I want to do is create weeds and create like too much confusion for you or overwhelm you with too much information. But I just wanted to follow the basic points that you need, basic obligations. Read your health and safety management system. Look through it. That could be part of your safety meeting planning. So for the year, Each month, we're going to pick a specific element of the health and safety management system and talk about it in the safety meeting. Maybe involve some bulletins, maybe involve some information sheets from the Alberta government, but that could be another piece to it as well. So, thank you very much for everyone for tuning in and listening, and I hope this has helped you all. Now let's take some questions if there are any.
All right, so far no more questions, but I will say thank you there, and I've included a lot of links in the chat section, so a link to that safety management system template, which includes the safety manual, the safe work procedures, the forms, as well as examples of formal hazard assessments from different shelters. And so those are really great places to start to take a look if you're starting your formal hazard assessment process. I'll also be sending a follow-up email with a video and all the resources included, including the PDFs that Astrid has included here. If you do have more questions after this, if you're thinking about them, feel free to send them to me, send them to Astrid, and we'll do our best to make sure that everyone gets those answers. I have also put a link to an evaluation, a short evaluation in the chat box. And if you could take a few minutes, that would be really helpful. It would really help us narrow down what types of topics you would like more support on around the safety management system, as well as occupational health and safety in general. So if there are any final questions, go ahead, Astrid.
That, Katie? So normally when I do a training session, I'm looking at a room of faces. So it's instant response to what I'm saying, if people are understanding concepts, if people are acknowledging what I'm saying. But I'm in my basement in Drayton Valley looking out, so I can't see any faces. So those evaluations really are important to me. I really want to make sure that I'm delivering you information that you need and that you understand and that I'm communicating properly. So please, by all means, if you could complete those evaluations, that would be fantastic. Thank you. That's it, Kate.
Wonderful. All right, so we did go a little bit over, but we answered some really good questions. And we'll follow up with an email in the next couple of days. And if you do have any more questions, again, we're always here. And I just want to say thank you so much for spending an hour and a half with us this morning talking about occupational health and safety, when I know there's so much other stuff going on right now. And I really hope this has helped, and really want to emphasize too that this is an ongoing process and we're here to support you through it. And unless there's any other questions, we'll say have a wonderful day. Enjoy the sunshine if you get it. Enjoy the rain if you get that as well, like I am. And we'll follow up with you very soon.
Hi, everyone.
Thanks so much.
Have a great day.